Hey, what's up? It's Dr. Taylor Krick, host of the Autoimmune Doc podcast, and here's today's study review. This one is pretty straightforward. So if you follow this channel, I like to pick studies or show studies rather that confirm some of the things that I talk about on the podcast. This one is pretty straightforward, and it's low levels of vitamin D in women with endometriosis and associated pelvic pain. So the point of this is just to show that there's an association. Now, I'm going to highlight some of the things, but again, if this is something that you're dealing with, this is a low-hanging fruit. There are other videos on this channel about other lifestyle things, other nutraceutical things, and the purpose of this entire channel is just to show you that the literature exists, the research exists, to at least prove that it's worth a shot. Not that it's guaranteed to work or not that it's going to take away your endometriosis or your pelvic pain, but just that, and the point with that is that I don't think vitamin D is going to heal that, but I don't think you can do it without it. And that's what these studies confirm. So this is a letter to the editor. It's in Clinical Chemistry and Laboratory Medicine, January 2017. And it says endometriosis is a chronic estrogen-dependent disease affecting 6 to 10% of women. It's associated with dysmenorrhea, pelvic pain, and infertility. Pain could be severe, and in practice we see that very, very often. So it talks about vitamin D is involved in many processes of the reproductive system. In particular, the endometrium represents an extrarenal site of synthesis of vitamin D, so it actually makes vitamin D, which could influence its cyclical changes. Vitamin D may also occur in ectopic endometrium, probably playing a paracrine effect. It says vitamin D binds to the vitamin D receptor. It's ubiquitous. It's found in all tissues, including the endometrium. And the possible link between endometriosis and vitamin D has been recently investigated because endometriosis often behaves like a malignant disease and shows several characteristics of an autoimmune disease. So, let's see where I wanted to go. Briefly, this study showed that women with endometriosis have lower vitamin D levels than healthy women of reproductive age. Moreover, insufficient levels of vitamin D significantly correlated with the presence of any kind of moderate to severe pelvic pain. This finding could be related to the lack of modulation of local inflammation due to low amount of vitamin D. And it says, here's another thing though, the reported effect of vitamin D on pain reduction, this is the mechanism, could be associated with the decrease in prostaglandin synthesis and the increase in prostaglandin inactivation by the suppression of COX-2 enzyme. So anti-inflammatory COX-2 is an inflammatory enzyme pathway, and suppressing that with vitamin D and upregulation of 15-hydroxyprostaglandin dehydrogenase. So that's saying that that could be the mechanism. Now, what the graph here is showing is that these are women whose vitamin D levels were high, above 30. That's not even high. 30 is like below 30 is insufficient, but that means they could be 31, they could be 41, they're probably not like 60, 70, 80. But these are percentages. So this is about 25% of people had moderate pain. This is a VAS, that's a pain scale. And then 75% of women had more severe pain. Now, so that's still a considerable percentage. But over here in the low vitamin D group, very few of them had mild pain. A lot of them had severe pain. So it was significantly correlated. There's the mechanism. Again, this isn't even I don't know, it's not even it's a letter to the editor, so it's a study, but I'm sure it's peer reviewed, but it's not even a clinical trial, I guess. I don't know how you classify this. But yeah, it's interesting. And again, the take isn't to get yourself to 31 and your pain's going to go from a 7 to a 4. The take is to get yourself into the optimal range, because vitamin D is not necessarily going to fix your pain or your dysmenorrhea or your endometriosis, but you can't do it without it. And there's other studies on this channel and out there, of course, that show the association of vitamin D with a zillion other things, including autoimmunity, gut health, COVID, any infections, immune modulating. It acts as a hormone, bone, calcium, just a myriad of effects from vitamin D. So I think the point isn't to say that this is going to solve all your problems. The point is to say, what are your levels? Are they where you want them to be? Because they need to be if you're trying to solve any kind of health puzzle.